Psych, I'm Kayla, and today we're going to talk about the NCLEX and everything you need to know from the eligibility to exam tips. Stay tuned. So exactly what is the NCLEX? It's the National Council Licensure Examination, which is a computer-based test that you have to pass in order to obtain your RN licensure or your practical nurse licensure in Canada, USA, or Australia. PN versus RN. So a lot of students are doubting which test is appropriate for them, but you want to make sure if you're taking the NCLEX PN that you have enrolled and passed a practical nurse or vocational nursing program. And then for the RN NCLEX, you want to make sure that you registered and passed a registered nursing program at your university level. So everyone always wants to know, how much does the NCLEX exam cost? If you're looking for licensure in the US, the fee is $200 US. If you're seeking for licensure in Canada, fee is 360 Canadian dollars. And remember, you can sit for licensure in Australia, and that is $200 US. Now, if you're looking to sit for an exam for the US in a different country, then the international scheduling fee is going to be an additional $150. How do you register for the NCLEX exam? First, you're going to go to your nursing regulatory board and submit your application for your RN license or your PN license. Then you're going to go to Pearson VUE, which is the testing center for the NCLEX examination, and you're going to submit your application and your registration fees. Once your NRB has given you eligibility to apply for a license, then you're going to have an acknowledgement of registration from Pearson VUE. Together, these are going to give you your ATT, which is your authorization to test for the NCLEX PN or RN. How is the NCLEX exam graded? It's graded based on 3 scenarios. Scenario 1, the 95% confidence interval rule. Scenario 2 is the maximum length exam, and scenario 3, the running out of time rule. The NCLEX algorithm considers the difficulty of questions, the number of correct responses, and the time it takes for you to answer those questions. The primary purpose is to ensure that the NCLEX applicant can effectively and safely ensure nursing protocols. What happens after you take your NCLEX examination? Pearson VUE Test Center is going to send your computer-based results to Pearson VUE for verification. 6 weeks after your examination date, you will receive your results from your nursing regulatory board. If you don't receive those results within 6 weeks, please contact your nursing regulatory board. Do not contact the Pearson VUE or their Pearson VUE Test Center. So what happens if you don't pass your NCLEX examination? The Nursing Regulatory Board will send you your results along with the candidate performance report that will highlight your strengths and weaknesses to guide you on your next examination. For the latest updates on the NCLEX and all things nursing, head over to the blog section on our website at www.bridgewayfirm.com.